When you have elective surgery, like my situation, they elect to stall you off as long as they possibly can, and the condition gets worse. What kind of a healthcare system is that?
Too many Canadians have stories like Jerry's. They visit their doctor for chronic pain, maybe it's in their knee or their hip, or maybe it's for some other kind of serious health problem. And then the government plays the waiting game. They've taken patients' money from the tax system, but they make people wait. A year for surgery, 2 years, possibly more. In the meantime, patients suffer. But did you know there's an easy way Canada could immediately cut wait times and get more patients the care they need? We'll look at a policy idea from Europe in a moment, but first, let's hear Jerry's story.
I'm Jerry Agar. I do a radio show in the mornings on News Talk 1010 in Toronto. I write a weekly column for the Sun newspapers. I screwed up my right knee when I was 18, and I had a knee operation, and they took out some of the cartilage, and they told me, well, you're going to have trouble like later in life. And actually it was later than what they had anticipated maybe, but for the last 10 years or so, just slowly every year, it was just worse. And I used to walk with a friend of mine, old guys going for a walk, in the afternoon. And finally I just said, I can't do this. And I kept harassing the doctor because I wanted to get something done. I was bone on bone. Like it's not like I had a little bit of some stuff that physiotherapy would fix. There was nothing left between the bones. So the upper and lower leg bones were doing this. And it just becomes impossible to walk.
The pain got to be so bad that it affected Jerry's quality of life. He couldn't go walking with friends, he couldn't ride his motorcycle, and it affected those around him. Jerry knew he needed care, and yet he had to spend months making calls and booking appointments before he can even be put on a wait list for surgery.
Finally, one day I was in the doctor's office and brought it up again, and she said, you really want this done? And I said, I'll do it this afternoon. And she said, all right, fine, and put me in the system, and it still took almost a year.
While languishing on a government waiting list, Jerry considered going to the United States.
If I was to go to Buffalo just on my own, it was like $15,000 American, and I was starting thinking of doing it, but then I thought, wait a minute, you're taking 40% of my taxes, which are considerable in this country, and I'm paying for healthcare. What would the government say if a private healthcare company was charging me that kind of money and refusing to give me healthcare?
In the European Union, patients like Jerry have another option. They have the right to go to another EU country, pay for surgery, and then be reimbursed by their home government. Reimbursements cover up to the same amount their government would have paid to provide the surgery locally. If Canada copied this policy, patients like Jerry would suddenly have thousands of options available to them. Jerry would have access to government funding to pay for surgery, whether it was next door at a private clinic in Quebec, across the border in Buffalo, or even in Europe. He could have received the surgery he required immediately, instead of having to lose a year of his life.
What if they had said to me, well, it's going to be $20,000 Canadian to go to Buffalo? And they would have said, okay, but you're going to have to pay $4,000 of that. I would have gone immediately.
This policy also helps patients who decide not to travel for healthcare. Remember, each time a patient travels abroad, there's one less person on a waiting list, and everyone else gets to move up a spot in line. SecondStreet.org recently hired polling company Leger to ask Canadians about the idea of copying this policy from Europe. The poll showed 74% of Canadians like the idea. To learn more about this European Union healthcare policy, please visit secondstreet.org and don't forget to hit the subscribe button.